Spinal stenosis is a degenerative disease caused due to the narrowing of the spaces between the spinal cord, which is also known as the canal of the spine. As a result of it, the nerves going through the canal face pressure. The spine is divided into three parts such as cervical, thoracic and lumbar. In most of the cases, stenosis takes place in the lumbar and cervical area. If you experience any problem in the spine, try visiting the spine specialist in FORTIS, Chennai. Cervical stenosis. This type of stenosis occurs in the part of the spine of the neck. This stenosis radiates from the neck to the shoulders and also to the arms and hands. As it affects the spine, one feels weakness in legs and arms. This condition is called cervical spondylotic myelopathy. Lumbar stenosis. In this case, the narrowing takes place in the part of the spine at the lower back. It causes pain in buttocks, that radiates to the thigh and sometimes into calves, which is called sciatica. The pain increases while one is walking or standing and also relieves while lying down or sitting. Is spinal stenosis a permanent disability? As there is no medications or treatments that can stop or fully cure spinal stenosis, it happens to stay with you till death. However, you can reduce the pain or sufferings caused by spinal stenosis up to a level. If anyone is facing unbearable pain and difficulty in walking, the doctor gives the advice to undergo a surgery. There are also some non-surgical treatments for this. Non-surgical treatments. In order to prevent the spinal stenosis, you need to give special attention to the sitting and lying postures, proper lift and bend techniques. To reduce the progression of stenosis, one needs to quit smoking and maintain weight. To maintain your postures, lifting, bending and walking techniques, one also can take the help of a physical therapist. The therapist will also guide you with some exercise to increase the flexibility of the spine and legs. Does advancement in tech cure it? As mentioned earlier, spinal stenosis cannot be cured fully. However, the modern medical technology can reduce the pain and sufferings of the patient. There are some surgical methods that help to ease the pain. Laminectomy, spinal decompression. This is a surgical method where a small cut is made on the back and the muscles of the spinal region are moved in order to uncover the vertebra. Afterwards, the laminar arched vertebrae is removed and the nerves of the spinal region are exposed. Bone spurs and thickened ligaments are removed, along with a trimming of facet joints over the root of the nerves may be done in order to give extra space to the nerves of the spinal cord go through the canal of the spine. 80% of the time this surgery is effective for the patients of lumbar spinal stenosis. Spinal fusion. In the case of stenosis and spondylolisthesis, the surgeon joins multiple vertebrae in order to give one's spine extra stability. The process is done during laminectomy. Grafts of bone from one's hip are attached to several vertebrae in the place where lumina was removed. Grafts can be available from the bone bank too. After a few months, the bone graft can automatically blend with the vertebrae. Metal screws are also used in the area. Laminoplasty. If multiple levels of the spine are affected by stenosis, then a gap is made on the lamina within the canal of the spine. This is called the laminoplasty. A metal plate is fitted in the gap. So it is better to follow a proper diet to maintain your weight, do some exercises and pay attention to your posture in order to avoid spinal stenosis. If you face any one of the above mentioned pain and living in Chennai, and if you are thinking about the surgical techniques, consult with a spine surgeon in FORTIS Hospital, Chennai. For more info, check links in the description. Or visit FORTIS Hospital in Chennai.